Welcome back to Hot Flashes and Cool Topics. We are going to have such an interesting conversation with Dr. Alyssa Dweck. Welcome to the show.
Thank you. It's great to be here. I'm so excited to speak about all things menopause.
Well, we have been looking forward to this conversation. You have been in the world of menopause before it was a hot topic, and you have authored books on the vagina before we could even really talk about the V and not giggle about it.
And I'm
So
giggling. I'm sorry. I just
that's
giggle.
okay. See, it's still ingrained in us to be uncomfortable, which we
Right.
shouldn't, because if you are a woman, you have most likely have a vagina. So, it's something that we talk about, something that you need to get comfortable with. So we are thrilled to have you on the show. You recently went to the Menopause Society 2024 conference and wrote a great blog. I would recommend for everybody to go to bonafide.com and take a look at it. And there were some great takeaways from it. First off, I wanted to ask you about what you learned about cognitive behavioral therapy for menopause.
Yeah, I'm glad you're asking about this. This actually was so important at the Menopause Society that it was given an entire day of pre-course material just on CBT. So I have to say that I really enjoyed attending that. And, I'm not a mental health professional. So I wanted to learn more about CBT, how it's applied, and how it might be applied to my patient population as a practicing gynecologist. And what I really, really took away from it is CBT can be used for so many things. Of course, we spoke quite a bit about hot flashes and night sweats as where CBT could be a vehicle to help with that, but also sleep, also certain pain syndromes, also just so many anxiety conditions, and also sexual conditions, which really can be helped by CBT. And look, this is a non-invasive way of managing symptoms that have many more, much more invasive treatments. So why not consider this, use it as an adjunctive management tool to some of the medications and other things that we have. I was particularly blown away by some of the virtual reality tools that they brought into some of the lectures to suggest how people might be able to access CBT when, it's not always readily available for people.
Were there any particular methods that stood out to you that would be easy for people to use?
Well, easy, no.
Yeah.
Interesting, yes. So I was, this is a little bit, off the topic, but I was truly moved by some videos that were shown of patients who have gastrointestinal related illness, chronic pain, who really are just unable to get relief from some of the standard treatments. They were hospitalized. They put on their Vision Pros, and I have nothing to do with Apple, but it was incredibly cool to watch them go down a journey involving CBT with visual aid from this Vision Pro. And it was heartwarming, heartbreaking, and these people really were getting better. So I'm hoping we see more of this coming down the pike. And we know that it can be used for things like hot flashes and night sweats as well.
Was there any data like to show results or anything?
They did present data. Again, this is being spearheaded, I believe, in California by providers there, of course, because it's in everything started in California. But I'm sure we have a lot more coming down the pike to learn about that.
And we'll provide a link in the show notes for Vision Pro so people can take a look at the website and learn more. Was there talk about AI in the world of
Sure.
menopause?
Yeah, there was a lot of talk about AI. One app that was discussed, which of course was using data provided by AI, was a predictive app to see who was going to have a successful vaginal delivery out of all people who come into labor in the hospital. And again, not necessarily related to menopause, but really opened our eyes to the fact that these algorithms and data provided by AI can really be used in a predictive manner And it may also be helpful to, help people with their treatment plans as time goes along, whether it has to do with labor and delivery or, menopause coming down the pike.
All stages of women's health, which is important to know.
It
And
is.
hopefully
Yeah.
down the road, it'll lead to more menopause conversations as well. Were there any surprises for you? Did anything go, oh, I didn't know about that this year?
Yeah, yeah. And I'm hoping you'll ask about testosterone therapy a little
Oh,
bit
yeah.
Oh,
because
absolutely.
Yeah.
so the big surprise for me, and it should not have come as a surprise, but there was a fantastic lecture given about the voice and menopause and how the voice actually changes as a result of menopause and possibly age, but that testosterone therapy, which we do use off-label for women who are suffering with lower libido or sexual drive, that testosterone therapy might have a permanent effect on a woman's voice. And I have to say, I have a lot of patients who are very open to testosterone therapy for their sexual drive needs and complaints, especially if they're distressed by that. But when you talk about side effects like hair growth or acne, they can kind of, accept that and note that they are reversible if they're uncomfortable or if they occur. But deepening of the voice that is permanent is really something that really didn't dawn on me as something to counsel patients about who want to take testosterone. So that is now part of my conversation. And while I have not had any patients complain about this, what if I had a patient who's like an opera singer or something along that line where it really might make a very, very vast difference?
Before we even get to talk about petitions, could you specify when it comes to testosterone treatment and the voice, is that applied to creams, to pellets? What's your position on pellets?
Yeah, I would have to say it's applied to all of the above. So, the standard is to recommend testosterone in the traditionally FDA approved male formulations and maybe cut the dosage down by about a tenth, particularly with the formulation that I normally prescribe. But I have to tell you, this is cumbersome, it's messy, it's often not approved by insurance, and it's expensive. So we do need some workarounds in order to help women get the testosterone that they may benefit from. So, I have normally relied upon reliable compounding pharmacies that I'm familiar with, where I know the pharmacists and I can speak to them and they have a good reputation and rapport to formulate testosterone gels for my patients. And I typically will recommend them topically. I always check levels beforehand of testosterone, and then I follow them usually 3 and 6 months later to see how we're doing and how people are responding from a clinical standpoint. I do not provide pellets. I have to say that they are frowned upon by the Menopause Society, and they do scare me a little bit just as a physician and as an individual person, only because once they're in, they can't get out. And you really do have to wait for them to, resorb on their own. And I just think that the dosing could be excessive because, everybody's individual. So providing pellets for one person may have a different type of dosage response than in another. I will also say that the practice I'm in doesn't allow things like this. So, maybe they're saving me from myself. I do not know. Either way, pellets are not my thing, so I'm not really an expert to comment on that. As far as oral testosterone, so I'm around long enough to remember an amazing product that was called Estrotest. And this was a combination oral pill of estradiol and testosterone, methyltestosterone, that was FDA approved for women. Don't really know why it went off the market, but it is unavailable. And so now we really rely on creams or the FDA equivalent for men.
Yeah, I think, Colleen, what I was thinking about, and it was telehealth. And I believe
Right.
we
The
heard from another.
unboxing of
Right. Yeah. The telehealth for testosterone. We spoke to another doctor that was concerned that that might be kaput as of January. Was there any talk about that, or do you know anything about that?
I must have missed that lecture.
Okay. And maybe it wasn't even at the Menopause Society. Maybe it was something else that
It's
she
a
knew
social
about.
media. You see it a lot on social media, the
Sure.
platform, that there's conversation that they want to remove the ability of telehealth to prescribe testosterone.
I see.
Creams.
Look, telehealth has been an absolute game changer in our world. And I do believe it's here to stay. But as with everything, there is a balance of good, bad, reputable, ethical, and medically sound. And I think the newer statement that just came out by the Menopause Society really honing in on estrogen therapy, but honing in on the misinformation that's out there. And patients are literally coming in and asking for this anti-aging panacea called estrogen to basically just cure them of all their aging-related ailments. And that is just not really the way estrogen works, and it's not a responsible way to practice medicine. So, I think we're finding our balance between what we're hearing from influencers on social media who may not have a medical background and other.
Right.
We talked recently about the misinformation and got quite the kickback from some people. So
We
know
did. We
Yes.
did.
we know how
Yes.
controversial and touchy of a subject
Wow.
that is. But another thing that I had read about when I was looking at your blog is that, Veozah is now on
Yeah.
is now FDA approved and can be sold for women as a non-hormonal option for hot flashes, and as Town should be out soon. But I didn't realize that they had changed the Veozah recommendations because of liver studies. Can you talk about the liver studies?
Yeah, absolutely. So I was not involved in any of those studies, but obviously as a practicing physician and chief medical officer at Bonafide, it was my responsibility to learn about this. And I thought it was another really loud message that we got at that meeting. So bottom line, after lengthy post-marketing survey, which is standard for all drugs, they go through their studies, they get FDA approved, and then the FDA still watches them and watches for adverse events over time. And I think this was a 52-week time span. And there were more concerns about hepatotoxicity or troubles with liver enzymes elevating as a result of this medication than originally anticipated. So the FDA has changed the prescribing labeling of Veozah or fezolinetant so that instead of what was originally recommended, which meant we should check liver enzymes before starting this medication at month 3, month 6, and month 9 after use, just to make sure there were no bumps of concern. But they've now changed their recommendation that this liver function testing should be checked baseline, meaning before starting medicine, month 1, month 2, month 3, month 6, and month 9. Again, with the thought to either discontinue or monitor with more surveillance if these levels are going up. The liver is really responsible for metabolizing everything, and loads of medications. So if the liver functions are altered, not only can somebody become sick or have signs of liver difficulty like jaundice, like change in urine and stool color, but other medications can be affected in terms of their metabolism. So this is very important, and it's good that we know to do this. The reason I brought that up is because a lot of patients won't necessarily want to be compliant with having to come in for blood testing that often. And it is on our watch that we have to remind people to come and do these things out of safety, because after all, above all, do no harm. This is what we agreed to as physicians. So, I thought it was a news flash worthy of sharing.
Right. I was going to say just liver issues there's also with the hormones as well. Doesn't
Yes.
that, because I've had liver issues and I am on hormone replacement.
Yeah.
And actually I go in, they want me to go in all the time. And I stopped supplements and things went down. Just, they had nothing to do with my hormones. This last visit, my my liver enzymes were elevated again.
Yeah.
Can that be just, I'm curious, could that be related to her HRT?
Well, this brings up such a good point. So look, what could it be related to? I mean, it could be a medical condition, and I'm just speaking very
Oh, I know.
broadly.
Yeah.
It could be Tylenol use, which is metabolized through the liver, and this is why we have very specific dosing for that. Alcohol use, other medications, hormone usage, yes. But this is why there is such a change in the administration of hormones now to be transdermal, so that we can really avoid and prescribe more safely and with more, conservativeness, if you will, estrogen through a patch or through a cream or through a gel. I tend to prefer a patch, and I think most of my colleagues do as well, because this bypasses what we call the first pass effect through the liver, meaning when medication has to go, through your mouth and through your digestive tract, it gets metabolized by the liver before it gets into your bloodstream. But when you apply it transdermally, usually through a patch, it goes straight into the bloodstream and avoids the liver. So enzymes would be, considered sort of protected, if you will.
Right. And I do have a patch. That's what I wear. And I had a telehealth visit with my doctor on Friday, and she had started me on a statin.
Yeah.
And then she said, let's stop that for a little bit.
Yes.
I told her I thought it was alcohol. I did. I said, we'll go out to dinner. I'll have some wine. I don't drink every night, but she was being very generous, I think. But,
sure.
I always tell Colleen, my corpse is going to have this patch on me. I'm like, she said, well,
yes.
you check the hormones. And I was like,
and you are not alone.
No.
I mean, I have patients who, once they start hormone therapy, they feel so good and so much more improved. They would truly just say, I'm never going to stop this. And of course, we're going to revisit that every 6 to 12 months, but I hear you. I will say, though, as chief medical officer at Bonafide, one of the other reasons that we were very interested in learning about this is because the mechanism of action of the medication fezolinetant and the other elazinetant that you mentioned is so novel and so interesting that the R&D department, and we have a big R&D team that is so super stellar at Bonafide, they were so interested in that mechanism of action where medication works through different receptors than hormone receptors in the brain, that they literally since 2021 have been researching ingredients that are nature derived, if you will, that can work through a similar pathway. So we are grateful to these pharma companies who have not only found these types of pathways, but have educated the public on them, because we really found that we could formulate a supplement that could work in a similar fashion and hopefully provide relief to menopausal patients who are suffering with hot flashes and night sweats, but who don't want to take hormone therapy or who cannot take hormone therapy, or after hearing about this liver function requirement, maybe want to consider something else at this time, because after all, there are a lot of alternatives. So of course, I'm dying to tell you about Thermella.
I was about to say, can we talk about that? Because for those of you who don't know, Bonafide offers alternatives that are non-hormonal in nature. It's a wide variety of medications. You've had over like 1 million women rely,
and they are not medications. I'm gonna just
no, that's
clarify.
fine.
Sure.
They are supplements. They are non-drug. We also have a device, which we could talk about separately, and that's for vaginal dryness. But the Thermella specifically is an oral supplement. And as I was saying, the R&D department researched loads and loads and loads of ingredients and found 3 that not only work individually to bind those same receptors in the brain that novel mechanism relies upon, but when they are put together synergistically, they really, really work super well to bind those NKB receptors. So We have found now in many, many studies, and we'll go through as much science as you'd like on this, that this product called Thermella, which combines curcumin, particular type of curcumin, extract, decaffeinated green tea extract, and also a spirulina extract put together, worked really, really well to block those NKB receptors in a non-drug, non-hormone way, and really provide a lot of relief for hot flashes and night sweats, similarly to the mechanism of action of the drugs we were speaking about.
Wow. Can you talk about the fact, since it is a supplement and we're talking about liver issues, is there any concern with the supplement going through your liver?
Well, we were very concerned about it. And that's why during our clinical trials with people, so we've done trials in test tubes to make sure that the science we think is working is actually working. And then we did trials in what we call preclinical studies, which relies on the animal model, so specifically in mice. And we saw excellent results, and we saw safety in those studies. So as we checked the mice's liver functions and we checked their hormone levels. And once we have really good results from that are reassuring, with safety and efficacy reassuring, we look at clinical trials in people, and we took the attention to check liver function testing in our participants because we had concerns about that. And they were fine, thank goodness. Good. So we really feel very comfortable that this is a safe and effective supplement for this purpose. That is not a drug, and it is not a hormone. I think it's also important that we didn't see any other adverse effects that were different than the placebo group in our latest 2 clinical trials. So again, confidence. And we at Bonafide, we really rely heavily on this type of sciences. We don't want to just be a random, snake oil type of supplement type of company. We are heavily research heavy.
When you were talking about that, if let's say that the doctor's like, it's your hormones, Bridget, you're going to have to stop that. Would this be a great alternative, or do I need to be careful because of liver enzymes being elevated?
Well, this supplement alone does not give concern. However, I would always check in with your healthcare provider, because everybody has their own individual medical issues and medications and lifestyle habits that they bring to the table. And those things have to be accounted for. So, obviously, if you're somebody drinking 3 to 4 alcoholic beverages per day, your liver is probably on overdrive anyway, and any supplement that's metabolized through the liver needs to be taken into account, as would medications. So, of course, that's a huge exaggeration, but I'm just trying to make a point.
Sure.
It was very exciting when we saw that Bonafide was acquired by Pharmavite, which for people who are like, who's Pharmavite? It's like nature-made products and such. That acquisition, did it allow you to even do more research? What is the future of Bonafide now that this acquisition has happened?
Oh my God, the future is just ridden with opportunity and excitement. This was an incredibly exciting time. So Pharmavite is the largest supplement company, I believe, in the country, with a wonderful reputation, also very science-based. This was a very natural marriage, if you will, for acquisition. And I feel like our resources at Bonafide became larger and more vast. The scientific minds working on our products and the availability of other products and lab testing and that type of thing became more vast. So it's super exciting, all positive. So that acquisition is almost a year old, maybe even we're at a year. And it just seems like the cultures really meshed. Bonafide really maintained its freedom to continue operating the way that we always did. And I've been with Bonafide a little over 5 years. So I've had the benefit of watching this whole thing unfold. But, it's wonderful. It's like having a vast amount of resources at our disposal, but still functioning as a smaller company with a particular mission.
when we go to conventions or conferences, we often see Bonafide there. And I think the first product that I became familiar with was the Reverie, which
Yeah.
is a vaginal moisturizer. Is that one of your top
Yes. I would
products?
say this is a very top product, and in part because it's fabulous, but in part because it is so needed. The vaginal dryness and the discomfort during intercourse and the just general sensitivity and change that occurs in the vaginal and vulva tissue as a result of low estrogen during menopause is huge and really underreported still after all this time when we are talking about V's and vaginas, if you will. So I think that for those reasons, it is an incredibly popular supplement because it works. So for those who are unfamiliar, this is actually a device. It's not a supplement because it's not an oral tablet and it's not taken orally. This is a vaginal insert or suppository. It's small and very easy to use. It's typically used 2 to 3 times a week at night in the vagina, and its primary active ingredient is hyaluronic acid. And hyaluronic acid is something that we all make and that diminishes with age and time, but it's helpful for moisture. And hyaluronic acid in the lab holds on to 1,000 times its weight in water. So naturally, if it's used as a moisturizer, and it's in lots of our face products and that type of thing, but naturally, if it's used as a moisturizer in the vagina, it's going to hold on to moisture. But more importantly than that, we've had multiple studies on Reverie to make sure that it is safe and effective. The one that I'd love to mention is one that was done by NYU, which of course is a prestigious institution here in New York. And it was presented at the Menopause Society last year as an abstract and a poster presentation. Essentially, it was compared head to head in a randomized controlled trial in women with moderate to severe vaginal changes or atrophy as a result of menopause, head to head against estrogen cream, the gold standard for vaginal dryness and those symptoms of menopause. And it performed as well as estrogen. So people would recommend it to their friend, if you will. HCPs were happy with it. It helped with dyspareunia or uncomfortable intercourse. It helped with dryness and day-to-day sensitivity, but it also, gave equal changes to the visual appearance of the vagina so that it became more elastic, more pliable, less easily traumatized, if you will, so less delicate. So this was a great study done over 12 weeks. So it was really a wonderful study, gave us a lot of confidence.
That is something we hear from so many women. We hear so much about sex and libido. And I think they feel like this is a safe space, and with
sure.
Bonafide, it's a safe space as well to talk about it. And a lot of them are very scared or very nervous about doing vaginal estrogen. Plus, you have to get a prescription for it. And that is I know people really hold back about going to a doctor, or they just don't want to bother with the trouble of it. So that is a very nice alternative right there for that.
It is. And even the menopause statement, like the Menopause Society puts out statements on these subjects for guidelines for all of us clinicians to follow and for, consumers to see. And in fact, non-hormonal moisturizers are even recommended first line for this problem. So, and it's easy to use. But what I find with my patients is that the insert is really well tolerated and it doesn't cause as much of a mess as some of the creams. Now, some people like the creams because they just prefer that individually, but most report to me anyway that they prefer not to have the leakage. So it's a wonderful alternative.
And I know right now listeners are saying, well, can I get Bonafide at a store? Is it direct to consumer? Is it through my doctor?
Yeah. So it is direct to consumer off our website, number one. Number two, available. So it is not available in stores yet. And I'll leave it at that.
Okay.
A
Okay.
little scoop there. Okay. Also, I was surprised when I was looking through the website. I didn't realize you had hair serums because a lot of our listeners complain about changes in your hair, and we've done
Yeah.
several episodes about it. But you
Yeah.
also, you really, it's a wide variety of products.
Yeah, it is. Well, we're trying to really address a good portion of the really significant symptoms that the menopause population has concerns about. I did want to just make mention that we had such a great result and a response to Reverie that we created. I shouldn't say created. We are now offering a extra strength sort of version called Reverie Plus. So for those with really significant changes or who just want to go straight to the big kahuna, if you will, Reverie Plus is available. And that contains double the amount of hyaluronic acid for more moisture. And it also contains sweet almond oil, which is known to be a good moisturizer and a moisture barrier. So it really helps to kind of keep the moisture in. But yes, we really pride ourselves on considering what the most distressing symptoms are for the menopause population and the perimenopause population, to be frank, and to really try to address those symptoms. So the hot flash and night sweats problem is being addressed, the vaginal dryness problem, which is a huge issue, and I think, again, underreported. You talked about the hair loss, but we also have something for perimenopause and premenstrual syndrome mood changes and irritability called Serenol. We also have a probiotic, which has been researched well, that helps with vaginal odor that's not related to an infection, which we see an awful lot in the menopause and perimenopausal populations. And yes, of course, the hair products as well.
That, you answered all those questions. I was going to say, can you
Yeah.
talk about some of the products
Yeah.
that you have? But that really is amazing that you can rely and get these products, because I talked to, Colleen knows this. When I was going through perimenopause, I thought, well, nobody else is going through. I must be the weirdo. I must have some strange things happening. But now the conversation's getting out there, and can you share the website? Because I know it's not really, is it bonafide.com or is
No,
there?
yeah, good question. It's
Yeah.
hellobonafide.com. So,
And we'll
Yeah.
have the
hopefully
links
find
in the
it.
show notes so you
Yeah.
guys can go right to Hello Bonafide. I know it's
You,
always, if you type in something, sometimes you get something else and
yes,
you're
Right.
like,
So
you are
look
so
for the
right.
right one.
You know
Yes.
what I
Yes.
also want to make mention of, because it really brings us back to the statement that the Menopause Society just brought out about misinformation. The Bonafide website, and I take particular individual pride in this, we have so much information in the form of a blog, and also we publish our clinical studies and data on the website because we want people to get educated and we want people to understand facts and what's known in the medical literature rather than, some random social media influencer's opinion on something. So I really find that that's very important. We get loads of questions and interaction, which is nice. And I can truly say that I make sure that I interact with all of these blogs, review them for medical accuracy. We call in so many experts to comment on our content as well, and to provide some of our content. So I really take a lot of pride in that.
And I think that's trustworthy too. When you have a chief medical officer on there leading it up, that
a practicing
yes,
OBGYN who's in there in the trenches, as they say,
right.
talking to women,
Yeah.
seeing what works. It's
Yeah.
true, Bridget. It's
It
really,
is. Mhm.
you don't want someone who necessarily doesn't see everyday struggles and what works and what doesn't work. And with that, thank you so much, Dr. Dweck. We appreciate you coming on and sharing your information. And we just appreciate your time so much.
It has been my pleasure. Wonderful to talk to you, and so thankful for all of your work.
Thank
Thank
you. You
you.
too.
You too, really. Yeah.